Chirurgia de stimulare cerebrală profundă, pe scurt DBS, este o procedură chirurgicală folosită pentru tratarea bolii Parkinson și a altor afecțiuni neurologice precum distonia sau epilepsia. Prin implantarea unor electrozi în zone specifice ale creierului, această tehnică ajută la reglarea activității neuronale și la ameliorarea simptomelor. Profesor dr. Atila Ilmaz din Turcia este unul dintre cei mai renumiți specialiști în neurochirurgia funcțională. De-a lungul carierei sale a tratat pacienți din lumea întreagă, inclusiv copii. Cel mai tânăr pacient operat de el avea doar 4 ani și suferea de distonie, iar cu boala Parkinson cel mai tânăr pacient operat de neurochirurgul turc a avut 18 ani. Profesorul Ilmaz a fondat centre de neuromodulare la nivel internațional și a primit recunoașteri prestigioase, inclusiv medalia de onoare a Societății de Neurochirurgie Stereotactică din Orientul Mijlociu. În prezent conduce Centrul de Tulburări de Mișcare și Neuromodulare de la Spitalul Privat din Istanbul, Medicana Ataşehir.
Romania is not far away from Istanbul because I have a patient from the United States, I have a patient from Mongolia, I have a patient from Nigeria, Mozambique, Zimbabwe. So to come from Romania to Istanbul for this surgery is not a big issue. But this disease is progressive disease. When you touch the patient as a neurosurgeon, you need to work with them all of their life. You need to take care about them. With the deep brain stimulation surgery, we are not curing the disease. We are only suppressing the symptoms and trying to improve their life quality. But the disease will be continue all of life and the disease will be progressed. So you need to take care about the patients even after the surgery. How we are doing that? We are welcoming the patient and patient relatives at least 15 days after the surgery to remove all the stitches and to be sure the programming is okay. And after send them, we are continue to follow up them, calling them every 1 month, and after 3 months we are doing the detailed evaluation or programming by remote control. If the battery is deployed, they can come for replacement too. But from Romania, Istanbul is not a big issue. And we have additionally rechargeable batteries can take approximately 15 or 20 years. So it's not a big issue to come from Romania, in summary. No, it's so easy. We are doing the replacement of the battery in approximately 20 minutes and under local anesthesia. Because we are implanting the electrodes inside the brain, but we are connecting these electrodes to the battery by extension cables. When we need to replace the battery, we don't need to open here. We need to open only this incision, is around 5 or 6 centimeters, and then we need to remove the old one and put the new one under the skin. And we can do it under local anesthesia. It's very easy procedure, the replacement of the battery. With a pleasure, every time we are open. So far we trained 26 countries and I started this surgery in 7 countries. And I pioneered and opened neuromodulation centers in several countries. A huge number of my colleagues is coming here. For example, last week we had from Iran, we sent back neurosurgeon when he's finished his residency here from Yemen. And next week we will have a fellowship from India. So far I shared my knowledge with my colleagues from 26 countries. More than 50 colleagues came here to increase their knowledge. I'm open for that. I'm open to share all of my knowledge with my colleagues without any expectations. Both of these diagnoses is on horizon, not approved yet. The FDA approved is given for Parkinson's disease, dystonia, essential tremor, obsessive compulsive disorders, and epilepsy. There are some studies. They showed that it's inducing the regeneration of the brain cells, especially in hippocampal area, which is responsible from the memory. but it's not approved yet. It's on horizon. I hope, because maybe one day all of us will need treatment for Alzheimer, because the population of the age of the population is increasing day by day, because we are start to treat to some chronic diseases, and the people is not dying early. DBS right now FDA approved for movement disorders like a Parkinson's disease, dystonia, and essential tremor. In experienced hands, you can expect more than 80% improvement per case. Our results, thanks to God, more than 90%. But to be sure to have such results, you need to be sure the patient is a good candidate, using the most technological devices, doing the surgery in correct way, and the follow-up, doing the programming, and continue to take care about the patients. Because of that, we are traveling a lot. We are traveling a lot to see our patients in their country or near countries around their country. I cannot say it's difficult, but you need to pay attention. You cannot underestimate the surgery. You cannot think like that, 2 holes and sending an electrode is not a big issue. No, it's so important surgery. The surgery itself is not difficult, but since it's a lifelong disease, you need to continue to take care about them. The team, all the team members, neurologists, neurosurgeons, psychiatrists, and the other members like a physiotherapist, speech therapist, we have physiotherapists, we have speech therapists, we have nutritionists, we have 2 psychologists, only belong to the team. And you need to have the most technological devices. It's so costly, of course. And you need to have the good radiological center department, and you need to have the most state-of-art of surgical equipments, and you need to have a time to take care about the patients for follow-up. You know, since I'm doing only the brain stimulation surgery, and I have 3 days per week in operating theater reserved for me, there is no waiting list, because we can do every week 6 cases, because I'm doing only the brain stimulation surgery. And the second thing, since I'm traveling a lot to take care about my patient or giving a lecture, share my knowledge for the societies of my colleagues, you need to ask my schedule is available or not. But we don't have long waiting list, because we are doing surgery, 6 surgeries per week. The Parkinson's is not end of the life. If you have a chance, if you are a good candidate from surgery, please don't waste your time.